a century since Teddy Roosevelt first called for health care reform. It's been attempted by nearly every president and every Congress since. And our failure to get it done year after year and decade after decade has placed a burden on families and on businesses and on taxpayers that we can no longer sustain. So I may not be the first president to take up the cause of health care reform. I am determined to be the last. The good news is we are now closer to reform than we've ever been. After debating this issue for the better part of a year, there's now agreement in Congress on about 80% of what needs to be done. 4 out of 5 committees in Congress have completed their work. Yesterday, the Finance Committee, under the leadership of Max Baucus, put out its own bill. Each bill has its strengths, and there are a lot of similarities between them. And our overall efforts have been supported by an unprecedented coalition of hospitals and seniors groups, businesses, drug companies even. Most importantly, doctors and nurses are supporting this effort. We've got doctors, medical students right here in the house. See, I just want to point out, I think it's telling, some of the people who are most enthusiastic about health care reform are the very medical professionals who have first-hand knowledge about how badly the system needs to change. You know, stop paying attention to the folks who are spreading false charges, crazy rumors about our plan. Pay attention to the healthcare experts, the doctors and the nurses who know our system best. It's fine that we've been hearing constructive criticism about these issues over the last several months because this is a big deal. That's how our democracy works. No one has all the right answers. We've all got a stake in getting this right. That's why I've said I will embrace good ideas wherever they come from. We already have. But too often during this important debate, we've also seen the same kind of partisan spectacle that has left so many people disappointed about Washington. Too many engage in scare tactics instead of honest debates. Too many use this as an opportunity to score short-term political points instead of working together to solve a long-term challenge. I've heard a lot of Republicans say they want to kill Obamacare. Some may even raise money off it. But when you ask these folks what exactly my plan does, they've got it all wrong. When you ask them what their solution is, it amounts to the same old, the same status quo that's given us higher costs and more uninsured and less security than we've ever had. It's more of the same. Look, I will not accept the status quo as a solution. Not this time, not now. The time for bickering is over. The time for games is past. Now is the season for action. Now is the time to deliver on health care reform for the American people. So, just to make sure you're clear, here's what you need to know about our plan. For those who have health insurance, you'll have more security and stability. It'll provide insurance to those who don't have insurance. It will slow the growth of healthcare costs for our families, our businesses, and our government. Let me say, if you already have health insurance, nothing in this plan will require you to change what you have. What this plan will do is make the insurance you have work better for you. Because under this plan, listen up, young people. Under my plan, if your parents have health insurance and you're currently on their policy, you will automatically be able to keep your coverage until you're 26 years old.